Hi, I'm Taylor Heaton with Mom on the Spectrum, and today I'm genuinely honored to share the screen with Dr. Kim Sage as we discuss the intersection of autism, narcissism, and trauma. We'll explore questions like: are autistic individuals more likely to marry a narcissist? And do autistic people experience a higher level of trauma than the neurotypical population? My goal in asking Dr. Kim on the channel is to help our community spot trauma and narcissistic abuse and to empower us with ways to take back control of our lives. There are so many layers of expertise in this video. I encourage you to save this video to your watch later playlist so that you can come back for a rewatch to get anything you missed the first time around. Dr. Kim is a licensed clinical psychologist with a doctorate degree in clinical psychology and a master's degree in marriage, family, and child therapy. She specializes in healing childhood trauma at the hands of parents who struggle with narcissism and borderline personality disorder. It's obvious her work is helping people all over the globe. Across all her social media platforms, she's approaching 1 million followers. This is an interview I've been looking forward to for a while, and I hope you come away from our conversation feeling seen, understood, and optimistic about a future where you can use your voice to create a life that feels safe and good. Dr. Kim, thank you so much for being on the channel today. I think that between autism and narcissism and trauma, I'm trying to remember cats, Taylor Swift, White Lotus. I think we have a lot of things, a lot of special interests in common. So thank you so much for being on today.
Oh, yes, I think we do too. Thank you for having me on. I think it's going to be a great collaboration. I know people have asked me about it before. And just side note, White Lotus last night was insane. So,
Okay, no spoilers because I haven't watched it yet.
okay, we'll
It's on
talk
my
about
list tonight. It's on my list tonight to
okay,
watch.
okay.
So.
You have a special treat waiting for you. Yeah.
Okay, I'm really excited. But yeah, so trauma and autism, the intersection of those two things is one of my special interests. And I don't have a psychological background. So when you were willing to sit down and have this conversation with me, I was like, yes, because I think this conversation will help the autistic community so much. I've noticed so much overlap between trauma and autism. And you are the one that I hear talking about it the most with the most clarity and insight that has been incredibly helpful to me. So if it's okay with you, I'll just kind of start down my list and we can see where it takes us.
Perfect. Let's do it.
Okay, so first of all, I'm curious, which neurodivergent traits do you personally identify with? And then kind of a second part of that question is how does that influence your psychological practice that you have?
Okay. Well, I mean, I think it's important to say this, and I've shared, I didn't know anything about autism. You have to be specifically trained as a psychologist, right? So about 2 years ago, I kind of discovered, I think like many of us, oh my gosh, what is all this happening on TikTok and these conversations? So I began my deep dive. And little by little, I was like, oh, that sounds relatable. That's me, right? But I would say that, and now where I sit, it's sort of like, okay, I cannot deny it. I look at my family, my kids, those things. But for me, I think it was the social communication challenges, feeling like an alien, like I'm faking
Mhm.
it, or, I'm doing all the things. Certainly friendship issues and my raging sensory sensitivities.
Yes.
Huge. And then one I recently discovered, I didn't discover this, but I mean, the research was that, rumination can be a form of repetitive behavior for autistic people, and especially among women. And
Mhm.
oh my God, my whole life, I've always said I feel too much and I think too much.
I'm a ruminator for sure, yes.
Yeah. And then just like the raging anxiety. So, I mean, there are little nuances to having routine for sure. But I think those are the places that really started to pique my interest and say, oh my gosh, maybe this isn't all trauma.
So did you start, I'm guessing, doing deeper dives into those topics that you then started teaching about as well along with your practice?
Yes, I started researching, but very early on, a lot of people said to me, hey, yeah, you're not going to find a lot of research on this. You're going to have to go watch autistic creators. Make sure you do that. And that's something I always say to people. There isn't enough research, especially in the, internalized type, the female phenotype, any other presentation that is outside the DSM. It feels like the populations and the people were so far behind. And so it's been a
Mhm.
combination. Today, I just found an article on narcissism and autism from 2024. So it's like
Oh,
interesting talking about, well, we can get to that later, but there's still so much there. So that's kind of what I did. I kept like finding a topic and then I would look at everybody's stuff and I would try to write it. Then I would look around at my practice, which has become more likely, autistic over time. People have reached out to me since I started talking about this.
mhm.
So that's
Well,
what
and
else.
that's one thing I really love about the neurodivergent creators learning that way because I feel like, generally speaking, we have this draw towards authenticity. And a lot of us, we don't want to put anything out in the world until we have done that research and then compare it to our lived experience and then more research and then lived experience. And that sounds kind of similar to your approach, which I think is why I gravitate towards your stuff as well. So,
Yeah, I think that's the most powerful when, I mean, I always say, like, we're on a journey. There are things that I might say today that next year we might say, no, that's not accurate. Like, I don't like this idea of saying this is the one version of this, of really
mhm.
anything in the mental health world. I think we have to make space for what we don't yet know.
Oh, I love that. That's how I feel as well. So, I mentioned trauma at the beginning, and for those of us that don't know, could you help us? I'm particularly interested in the term CPTSD. Could you unpack that a little bit, and maybe particularly how it relates to the autistic community?
Absolutely. So at this time, we in the US, we generally, I get talking fast, I start to stutter. We generally recognize PTSD, right? And we say that is more like a single event trauma. So, you were robbed, you fell down, had an accident, you went to war, even though you were in war for more than one day, that's a single event. What we realize is that there's something called complex trauma, which is really what I kind of the way I describe it is relational trauma. It's interpersonal trauma that happens at the hands of what should be safe environments. It can be everything from, sex trafficking to me having an eggshell mother. It's a wide range. But essentially it's a chronic, repeated sort of violation of safety, security, sense of self at the hands of generally another human being in a relationship in some way.
Okay. And so with autistic people, what's coming up for me when you're saying these things is masking. Can masking over a long course of time when you're suppressing things that either you want to say or do, or you're not reacting to things that other people are doing that are upsetting you, can that influence, can CPTSD be a part of that experience?
It seems like it. We don't have a lot of definitive research, but there was an article last year that came out saying that autistic people were more likely to develop trauma symptoms from what were mild stressors compared to neurotypical people, which could be, an alarm going off. It could be anything. So I don't see, I mean, any time you are suppressing what you feel and who you are, and because to me, to be autistic is to by and large be traumatized. This is why I think it gets so complicated to try to pull the pieces apart. And so
Yes, and that kind of goes into something I wanted to ask about too. So I think you said being autistic kind of goes hand in hand with this experience of trauma. Do you have any other insight on that that you can share as to why those two things are so related?
I mean, I think it's a complicated dynamic because I also think that many autistic people have been raised, particularly by maybe high masking autistic parents who did not know they were autistic, right? Who had certain struggles that
Hmm.
we have maybe perceived as, oh, that's bad parenting, when really it's emotional dysregulation and oversensitivity and overstimulation. And so I think this idea that, first of all, your environment from where you're born, genetically, obviously, environmental influences as well. And then just to be, I think, in the world where you feel like maybe the way that you move through the world is not being perceived or received the way that you intend. And to
Hmm.
me, that's inherently traumatic. And then we know when you are a victim of trauma and or autism, you're much more likely to be a repeated victim of all kinds of traumas, from
Hmm.
parents, bullying, all kinds, certainly things like that, depending upon where you are, how you present, I guess, on the spectrum.
I like what you said about when things don't come across the way that you intend it to and how traumatic that can be, because I particularly relate to that as you're sharing that, because there's so many times I can think, especially when I was younger, when I'd say something and like I thought it was funny but nobody's laughing, or like I said something and it was serious but nobody understood that I was really hurting or in pain. So yeah, I do think that that's a really common experience that I've noticed for myself and also other people in the community. So thank you for your insight on that. Do you feel like autistic people, I mean, I guess this is kind of the same question, but do you feel like autistic people tend to have a higher incidence of trauma related events in their lives than like the neurotypical population?
Yeah, and that's what the research seems to support as well. And so it seems like our risk of trauma is higher, our experience is higher, and then the way that our brains might work might make the symptomatology, more complicated, harder to diagnose when you start to come into an office and someone says, "I've had trauma, but I'm autistic," but they don't see the autism. So like
Mhm.
all those pieces, I think, can really make it more complicated.
Right, and then I think the communication issues as well, or the social differences when we are in the medical office and we're trying to communicate, it's that pain scale picture that they're like, "What is it?" From a scale of 1 to 10. It's like, I don't know how to communicate to people like, "Yes, I'm really hurting. Like, this is really, really painful." So I think there's that communication breakdown as well that can kind of keep us from getting the attention and just being able to express our needs in the first place, which is really traumatic. And then my psychologist likes to bring up the term self silencing. I'm a self silencer, so there's a lot of ways in which I feel like I haven't been able to express myself, which I think kind of goes along with what you're saying about just the inherent trauma of not coming across, the way that you want to. That's really difficult.
It is, even with something like social anxiety. I mean, me growing up, especially where I think it's leveling out, but like doctors were up here and they knew everything. And so you
Mm.
go in and you have like 5 seconds, it feels like, to say the things. And
Yes.
this idea of challenging them, right? It's like, especially if you've had that experience of being disregarded or you're just nervous, you're not likely to say anything, regardless of how your brain works. But I think especially if you're on the spectrum.
Yeah, because we follow the rules. We do it where what is expected of us, and it's hard to be like, no, excuse me, please, like stay. I actually was proud of myself. I had an appointment a few months ago, and I told the doctor like, no, please, like I have questions here on my notepad, and I've waited for 2 months to talk with you, like please. So I'm getting better at advocating, but yeah, I think I'm the rule follower in me is like, okay, I don't want to take up too much of your time. We kind of mentioned at the beginning about narcissism, which is a really hot topic. I don't know. I'm really curious in your experience. I feel like as a non-clinical person who's just speaking about experience, I've run basically different support groups with autistic adults, and I am noticing, admittedly, I have no credentials to diagnose narcissism. I'm not saying that I do, but in my limited experience, it seems like a lot of us in these groups are connected to narcissistic personalities. Have you noticed in your practice autistic individuals being more connected to narcissistic individuals, whether that's in family relationships or partnered relationships?
Absolutely. And I was thinking about this question because when you are a victim of trauma, like I was saying earlier, you're also much more likely to be victimized. So if you
Mhm.
have this combination of something like taking things at face value, assuming people have the similar intentions to be good as you, that their empathy, regardless of where it is that they have it, right? Pleasing, recovering from trauma. I think all of that just makes us more likely to be victimized. I think being naive, as I look back in my own life, like just taking things, oh, well, you said that, so that's
Mhm.
what you meant, and not understanding nuance, and really sort of believing that people aren't capable of certain things, and then being like, oh my God, they actually are, right? I think
Mhm.
all of that makes people, more likely to be victimized.
And I feel like what I've learned is that narcissistic, and I don't know the language that you like to use, people who struggle with narcissistic tendencies, it's so much to say. Um, it feels almost that they need higher levels of empathy to account for their own lack in that area. Is that accurate?
Yeah, it's funny. I was just watching other things about that too. I think that they look for caretakers. I think they're really
Mhm.
good at looking for people to take care of them. And I think traumatized people are usually, many of us, especially women, like we get our value out of being nurturers and pleasers, and I can take such good care of you. And I think when you add in trauma, like, oh, I'm trying to live a different life than my parents, so I'm going to be everything. All of that, I think, loads us
Mhm.
up. And really quickly, I saw this study and it was talking about vulnerable narcissism versus that grandiose narcissism.
Mhm.
So vulnerable narcissism is more like I'm a victim, all of that woe is me kind of dynamic. And it was talking about autistic people actually measuring higher in that quality and themselves. It's like about being neurotic, about being anxious and depressed and more internalized. And so I was thinking, I wonder if autistic people looking for people to relate to might
Hmm.
initially connect to that. Oh, like they get this depth, they get this wound, they get this thing, and I think
Mhm.
maybe there's a glue that happens there, maybe,
Maybe
and then
like, is that what trauma bonding is?
kind of, yeah, essentially, it can be, and so it's sort of like, "Oh, and then because you're naive and don't understand where this comes from and the root of it, we're often
Mhm.
locked in before we wanna get out of those relationships. That's the hard part, once you realize it, you usually don't wanna leave right away.
Right, because then there's that feeling of stability of, like, even if this isn't a good thing, it feels consistent, and I know what this looks like in my life to be connected to this person.
Many narcissists present in the beginning as like, I can contain you, I got you, I can hold you. And when
Mhm.
you have any kind of complicated childhood, regardless of how your brain works, oh my God, that just sounds like everything I want. So I think that combination on both ends can make it difficult.
So in addition to finding ourselves in connection with narcissists. I think some of us are starting to wake up to this idea that, oh, maybe I'm connected to somebody that's not really as supportive as I thought they were. What are some signs that can help us understand if we are in this type of relationship?
I think it's hard because unless you really know what to look at and you don't necessarily have the skills of really, looking at what it brings up inside of you, which I think therapy can help do, right? What is this behavior
Mhm.
triggering me? I think things like looking for patterns, noticing how you feel when you're with them. I also think a big sign is when you are upset about something and you go to them, but you find yourself apologizing to them, going, "Oh, you're okay.
Mhm.
I'll just work harder at that. No, I can do that." Right. And so I think and then I was reading about like the gut instinct, how good or not are we at cultivating that? I think that when we learn to cultivate it, it can be quite strong. But if you learn to disregard it because you've been devalued in a highly invalidating environment, that can be difficult.
Mhm.
So
That y
it's hard.
that's what I come up against a lot personally, and then other people that I've been in these support groups with, how do we cultivate that intuition if we've suppressed it for so long?
That's difficult. I think that to me, it's always like learning how to, is there a pattern? I think patterns for autistic people is a way to start. Like, do you find yourself rethinking the same loop about them or being upset about the same interactions you have? Like, where can you start to, I always say be a detective, and I used
Mhm.
to run groups years ago. It's like, okay, what are you feeling? This was before understanding anything about autism, but what's happening? And then where do you think that's connected? Look at your childhood, look at relationships. And so I think that's a place to start, but I think it's kinda like a certainly like meditation, and if you can do it, I think I can
Mhm.
not do think about nothing meditations, but like guided
Right.
meditations, getting quiet, listening to yourself, and then trying to, learn to notice in your body maybe what you feel when something feels off. "Oh, my chest feels tight when he said that or she said that," or, "Oh, I left
Mhm.
lunch and my stomach hurts and it wasn't from what I ate," trying to cultivate your because I think your body for autistic people know. I think we are really alerted to our bodies.
Yeah, I think our bodies really try to tell us a lot, and I think many of us have gotten used to suppressing those signs that do come up, and I think still continue to come up even if we've lost touch with our intuition, we're still receiving those signs. I'm also somebody that struggles with sitting down, being quiet, meditation, and I know for myself and others in the community that walking meditation is really helpful for anybody that's feeling stuck in this right now. Go outside and walk if you can do that, just to kind of clear your head, and even just take check-ins throughout the day, as simple as that sounds, but I've started doing it once in the morning when I wake up
Mhm.
and once in the evening, and I'm not connected to this in any way, but there's an app called How We Feel, and
Mm,
it's free, and it's just like a quick 10-second check-in where you just take note of an emotion that you're feeling. This has been really helpful for me because I just I escape to my brain so often that I don't really take time to think about how I'm feeling. So those things have been helpful for me to kind of come back to myself, but I've realized that narcissists tend to have their own reality that is very, very real to them.
mhm.
And I feel like I've gone crazy trying to make a narcissist reality my own. Can you speak on that a little bit? Have you noticed that same pattern?
Definitely. I think, all of these strategies around once you realize someone has these kind of traits is different than trying to get them to understand it before you get the fact they have this diagnosis, right? So let's say you don't get it and you're like, that's part of that pattern, it's not working. But once you do, then I think your strategy has to kind of change depending upon what you're trying to get from them. And this is
Mhm.
something my therapist helped me with. It was like, look, this person has an agenda to feel a certain way. And so you trying to give them a little bit of that and get your needs met, not in a marriage, but like in other relationships, can be important. And so, that's where I would kind of start in that regard.
Yeah, it can be really tricky. I know that a lot of us have health issues as well, and I've read so many stories from people who say once they get out of narcissistic relationships that their health issues start clearing up. Do you feel like when we're in these types of relationships that it has an effect on our immune system?
Absolutely. Because at the root of what causes inflammation and high cortisol and everything else that goes with that is chronic stress, really toxic, I always get it wrong, chronic toxic stress.
Yeah.
And same thing going back to childhood, if you have trauma, remember, now you've already had, maybe it's autism and trauma. So your body's already been, you're already, in a chronic state of stress, essentially in a fight or flight.
Mhm.
So all the research obviously, points to that with those all the ACEs studies. So I think it really magnifies, and then disregarding your body's signals and symptoms that you learn to do in both trauma and autism. All of that I think can make it much more difficult to take care of ourselves and recognize when we need care.
And living in that chronic state of stress, I mean, I guess we kind of talked about it with the meditation. Are there any other tips or strategies that you've found helpful if you're in functional freeze or, you're just in this elevated hypervigilance? What are some things that we can do to kind of chisel away at that so we're not living in that state chronically?
Such a good question. Right now I feel like the trend is all nervous system regulation, which is 100% important. But to me, it's a combination of working through the relationship dynamics to fundamentally change how you show up alongside what you do with your body, right? So whether it's meditation, breathing, taking a break, some of the tapping, any of those things we've talked about, bilateral stimulation. I'm a big fan for just if you can. I mean, I live in California, so it makes it easy mostly. Just put on your shoes and walk outside. Like if I have my
Yeah.
flip flops, I'll just go for a walk around the park. It's like I can't work out tonight because I'm too tired because I have an autoimmune disease, but I need to get out of the house and with my body.
Mm.
And if you can do that without input, maybe don't listen to a podcast. Maybe don't listen to music. Just touch
Yes.
quiet. I feel like that's so restorative for me, just making myself do it when I don't want to. That's
Yeah, and I love consuming information because I love learning, and so I've kind of felt lately like I'm this spinning top, like a toy that's gets spent up, and I'm spent. I made up a word, but I'm trying to let myself unravel or stop spinning. I can't. I'm trying to stop myself from taking in more information until I've let the energy and momentum kind of go out a little bit. But I think that's one thing that I'm noticing dysregulates me is this constant absorption of more information. And it's scary to get quiet. It's scary to go on the walk because then I have to actually face what I'm feeling and the thing that made me upset enough to go outside, whatever it is. But I
Mhm.
think that's one thing that's been really helpful to me is slowing down, as scary as that is, to just listen. It's even scary for me to say it. Like I can feel like my heartbeat getting faster. But I think that's crucial for especially for the autistic community.
I agree. I agree. And I think right now, because of, I keep saying if you have a brain that needs to know what's going on, but also is
Mhm.
hyper-empathic, I'm struggling more than I've ever struggled with that right now. And then as a content
Yes.
creator, and I have patients who are content creators. It's like you can't not be online. I took a break for a while. It's like this is so much. But right now, like I don't know about you, but even when I try to resculpt my feed, it's just so much. And I really think that that is just making us more frozen and less likely to even
Mhm.
able to even think about what can I do?
I like the phrase they used, if you have a brain that needs to know what's going on, because that feels like me. I don't I know that I can't handle all the news headlines, but I do need to know what's going on, and I don't know how to balance that. It's really, really dysregulating. My cat just jumped on the desk. So that kind of reminds me of the realities, living in different realities, and especially going back to that with the narcissist. One thing that's really helped me is just to realize that if you're connected to a narcissist, they can have their own reality. My cat's moving my computer screen right now. Come here. Do you want to sit in my lap?
I'm surprised I've
You,
had no cats during this interview so far. Let me
how many
see.
cats do you have?
I just got a kit. Well, I have two cats. I just got a kitten though, like a month and a half ago. So
Oh,
let me
we'll
see.
see how long he stays. This is He has a funny name. His name is Beltray.
Beltray. Oh, he's beautiful.
Um,
He's orange. He's an orange cat.
he's an orange, very unique, strange cat with strange
Uh,
energy, but he's the best.
I always hear about orange cats. Yes, he's gorgeous. Oh, baby.
Yeah, but so with the different realities, one thing that has helped me is realizing that a narcissist can have their own reality. I don't have to make that true for myself. And I like Jefferson Fisher's stuff a lot too. And one thing he says is, I remember it differently.
Mm,
And that phrase has been really helpful for me in kind of establishing that I can have my own. It felt like a lack of empathy for me when I would like question the other person's reality. It felt like I was like lacking empathy or doing something wrong, but slowly giving myself that grace of like, no, my reality can be totally different and I can have a totally different experience. So many things coming up. The other thing I wanted to mention was another thing that's been helpful for me in identifying this is paying attention to a narcissist's apologies, how they actually apologize, what are they saying, what do they apologize for, and then how do you feel after they apologize? Do you feel like they actually heard you and made it better, or do you feel more frustrated and like silenced after that as well?
As you're talking, though, I'm thinking, when you find yourself, I mean, I know that we can't escape all the narcissists in our life. This is the
Right.
problem. But essentially, when you find yourself trying to like litigate the reality of something with them, I think to me, like that's the sign. The moment I feel that like urge to correct, if I know who they are, it's like that's not going to go anywhere. And so learning how I think to pause, to keep minimal contact, to have certain phrases or, the gray rock, whatever it is, ways
Mhm.
of those manners of connection, because at the end of the day, if you really believe someone is a fully diagnosable narcissist, I mean, that has a lot of flavors, but it's not going to ever be the reciprocal relationship you hope or long for. It's just not. And I think you have
Right.
to grieve that and figure that out and decide where you can have connection, if at all.
And I mean, that's something else I wanted to explore too, because when you do see that, you can't unsee it. You start to see the writing on the wall. And then, like you mentioned with patterns and autistic people, you start to see the patterns so much so that it becomes overwhelming. So you said, grieve the relationship. What connection can you actually have? What else can people do who are listening who think, oh my gosh, I'm trapped in a relationship with a narcissist? What can they do?
Well, I think that depends on what kind of narcissistic relationship. I mean, there can be some that are dangerous, and so it's not, it's the most dangerous time in the whole relationship is when that's ending and you try to leave. So
Hmm.
I think it depends upon when we say this term, it really matters because I mean, obviously there are other components that could be going on. But trying to figure out where you can get support, what your strategies are. A lot of people are trapped in those marriages, for example, financially. They don't have an out, right?
Hmm.
They've been a stay-at-home parent or their job didn't whatever or whatever it is. And so, it's about digging your way out where you can. I certainly think a good therapist can be helpful, but it is about survival. And once people realize that, it's just a matter of deciding how long can I stay before I'm like literally either at risk or just I'm going to lose myself completely. So it's not
Right.
like I don't say you can just have a good relationship with a narcissist. Like you can't.
Right.
Do you know what I
You have
mean?
to reframe what's like you were saying, what's actually possible in this relationship and get yourself to a place where you're safe if you are considering leaving. And like you said, finances can be a really big part of that. So maybe starting to grow your own financial thing on the side somehow to get money saved up so that you can take care of yourself. But yeah, it definitely can be a scary place to be in. I think it can be a very empowering place where you kind of start to see through the charade and you're like, oh, I actually like I read the book Codependent No More, and which is about dealing with an alcoholic, but it can go hand in hand for just any type of codependency, I feel like. And there was this empowering part of it where it was like, no, I'm not responsible for the alcoholic per se, but I actually have behaviors and decisions that I can make to stop some of the patterns. I kind of learned some enabling things. So I would say for anybody that's finding themselves like this, just realizing that there is some empowerment there and that you can start to become more aware of what you actually want and need in the relationship, and you're worthy of communicating those things. So it's not all gloom and doom. It can be the start of something. It is scary, but something new and empowering.
Every action has a reaction with a narcissist, especially. And so when you think about even within the context of like family systems theory or attachment theory says, oh, there's no such thing as codependence because that's around alcoholism there is, but not in other relationships that we have this like dance of reciprocity. And then other, belief systems around how all that works can be at odds with all of these concepts. But at the end of the day, when you make a shift, it forces a shift in them, right? So that can go good or bad, right? Depending
Mhm.
upon what happens. So I think it's also, you kind of have to know what you're dealing with because even changing your behavior could be catastrophic in certain kind of
Mhm.
and so it is about, I think, having your armor on and being prepared and taking those baby steps. But it is absolutely possible to get out of those relationships and work on healing and find healthier relationships.
Yeah, and there are more conversations happening about this now. I feel like there's more resources becoming available for anyone who is needing those. And now would be a good time. I know you've got some classes that are available on your website. Could you share with us a little bit about the resources you have available that could help people in our community?
Sure. Well, I would say, when I created these courses, nothing I've created so far is specifically for autistic people, though I would argue that I'm a person with that kind of brain who made these courses. And I really made them in response to thinking about people come to therapy. It's like that 45 minutes, whatever, 50 minutes goes by so fast. And
Mhm.
they're catching you up. You can get stuck in the content. So you want to get to the deeper stuff. But there's so much teaching and backdrop that you really can't provide. And I think people nowadays, they watch videos, they listen to podcasts. I think we're more informed than ever. But
Mhm.
then, once again, what do you do with that? That becomes complicated. But I wanted to share like really teaching people all of the dynamics around childhoods where we had, I guess now the term would be most often used emotionally immature parents, which AKA to me tend to be undiagnosed narcissistic BPD parents, parents who don't really know that they're struggling, or generationally, they kind of have that kind of lens where they're not able to have good self awareness, or they're highly
Mhm.
defensive. So the courses really are designed to educate people on, kind of what their childhood looked like, what the risk factors were, how they got there, and then include everything from, whether it's mentalization-based strategies, DBT skills, polyvagal theory, all kinds of stuff like that. So I have three courses, one on being raised by borderline narcissistic parents. I have one on reparenting and remothering yourself. I think that's a big wound for us as kids. I always say we're our inner child and we're our inner parent. We're both as
Mhm.
adults. And then I created one on really what I'm kind of obsessed with right now, which is hypervigilance, which what that really looks like. And for autistic people and traumatized people, that seems to be like, I keep saying it, the big crossover.
Yeah.
Hypervigilance seems to be really common in both.
Yeah, hypervigilance is exhausting. I need to check that course out for sure. But I liked on your website it said that your resources are designed to help make you an expert in your own healing, and that sounds very autistic to me because we like to be in control and we like to understand the pattern and be able to replicate that. So anybody in the community who's interested in those resources, I think you'll find them extremely helpful, and I'll be sure to put a link to all of those in the description. I'm realizing my brain's been a bit nonlinear in our conversation. If we could go back, I wanted to talk about. Um, I don't think we covered this. Can trauma like CPTSD and autism, can one be misdiagnosed for the other? Is there some crossover there in terms of symptoms and presentation?
There's a huge crossover, and in fact, I would argue that you would have to really be an expert in autism to start to tease those out. I think the typical clinician could look at a high masking autistic person and perceive our sensory issue. I mean, people argue all the time, that's not autism, that's trauma. It's like, I get it, but that's the problem. They're so deeply layered. And so
Hmm.
I think that they can be teased out. There are some nuances for sure, but it can be challenging if you don't understand what you're looking for.
And I feel like for myself personally, it kind of goes back to not understanding how to communicate about my internal experience. But I almost feel like I had to become an expert on autism before I could voice what my experience was like because I had self silenced so much. I think a lot of people go through this experience when they're taking the test, like the online test for autism. It's like, well, is that really how I feel? Or is that how I think I'm supposed to answer? Or like, am I trying to get a specific result? It took me a really long time to get to a place where I could answer and know that that answer was my answer and not what I felt like I was supposed to say.
Mhm.
So that's really interesting because I feel like even professionally, I'm just wondering from a psychologist's point of view, can you ever really know? And I don't even know how to phrase the question. I mean, you can't ever really know someone's lived internal experience. So, as a psychologist, how do you deal with that whenever you're diagnosing people with autism or CPTSD?
Yeah, it is difficult. And one thing I want to say really quickly, and I know I've said this before, is that there's been some newer research looking at the female phenotype, talking about how many women have been diagnosed with borderline who are actually autistic.
Yes.
And so this to me, and when you think about borderline, we tend to think about, I mean, there are some genetic and brain dynamics going on, but trauma at the core. And so that to me is where something like a misdiagnosis and stereotypes have been so incredibly harmful.
Hmm.
I lost track what I was going to say next. What did you, tell me what you just asked me again?
Yeah, there's so much like my brain keeps going off so many directions because there's so many interesting things here. But so, as a psychologist, how does that work when you're trying to filter someone else's lived experience against your clinical understanding of the diagnosis?
So, I mean, we're looking at, taking a good history. I think this is the big piece is that trauma is something we acquire. Trauma happens to us, essentially, if we're really going to act like they're completely separate. And we're going to be born with autism for whatever reasons, a neurodevelopmental disorder, essentially, right? So how does it, is it an onset, blah, blah, blah. There's a lot of, I think what we still don't know yet about all of the
Hmm.
factors, but it seems to be largely genetic. And so, we're going to have these things where it's not just like the trauma happened and then we have responses to the trauma. So I always talk about, I think I just made a video talking about, let's say you have sensory sensitivities, like, and you're traumatized, and specifically around coffee. And it happens to be that when you were harmed, the person was always making coffee in the morning. And the smell of coffee is repulsive, right? Like you have a strong reaction.
Hmm.
But when you have something like a lifelong challenge, it's going to be more about everything related to smells. It's not necessarily going to be specific. And so I think that's where these nuances can get difficult and trying to understand, I didn't like the tights when I was little and I had these issues in class and I had a trail of broken friendships. So we really want to understand it's not just like, how's your life been in the last few years? For me, if I'm looking at what's really going on here in terms of autism or trauma, I want to understand a history, and that has to be taken sometimes over time because people,
Hmm.
traumatizing to give your history. And we're learning more about that as clinicians. Like maybe we shouldn't start therapy this way. At the same time, people often want to come in. I will
Hmm.
get the most beautiful emails from autistic people I can tell like that. It is like a 7 paragraph
Hmm.
email and
Hmm.
it has everything. And I already give out, I mean, I have the ACEs, I have massive questions, it's like I have to read for an hour and a half before I see them.
Uh-huh.
I mean, just that alone, it's like they want to be understood. I feel like so many of us have not been, and the way the brain works, it's like,
Hmm.
here's the suitcase of like the stuff,
Hmm.
but it's really
Yeah.
helpful in diagnosing.
Well, and I noticed that I don't know if you noticed on your channel, but I've had people tell me like your channel, the comments on your channel are longer than any other comments on any other show. It's like the autistic people in the community, they share so much. And it's the same way with my emails too. But have you noticed that in your comments as well? You'll just have like these long stories that people leave.
All the time. And I'm,
Mhm.
as a psychologist, it's like, do I say I like this? Because what if they mention something harmful in
Right.
there?
Yes, exactly.
Yeah.
I I know it's hard. It's like I can't heart it until I've read the whole thing, but I can't read the whole thing because it's going to take me 4 minutes to like, read
Yes.
these whatever
Yes.
times 200 or however many comments. So I mean, can I ask that from a content creator? Let's switch gears for a second. How do you handle that when you have all of these? I'd love to know when you have all of these messages coming in, everybody's sending you a chapter book. How do you prioritize what gets responded to and what doesn't?
In terms of email, I don't because they're not patients. If they're patients, it's different, right? Once you're a patient.
Mhm.
Even that way, I'm like, part of it can be a sculpting. Like, I love that you wrote this, but can you come into session and can we talk about it?
Mhm.
It's important or history, whatever. I want to see it. If it's an email, I'm a one person show. And for me to even respond, it's like clinically and ethically, it's like I don't want them to think I'm giving them advice.
Right.
I read a lot of the comments, like, but someone put like, she doesn't respond. And I was like, I do read
I
them.
do. I
I,
see this then.
I saw this, but I get overwhelmed because I'm a
Yes.
human. And then just because of because of what I do, like if they mention self-harm and that, like I used to be suicidal, I'm like, I cannot, I'm not gonna,
Mhm.
you
This
know,
isn't the place to unpack that or yeah.
no, but I also it's really beautiful. I mean, I read what they share and it's like, God, thank you. I don't know. They're
They
opening
are so beautiful. And that's
Yeah.
what's so hard is like there's so many beautiful stories waiting to be read in the comments and the emails. It's like it just breaks my heart sometimes because like you said, I mean, I have a little bit of help now. I have an assistant that helps me, but like I'm one person and I can't just sit here and read all these stories, but it's so touching to see everything that comes through my desk. But on the content creator level, I had one more question for you that I'm going to throw in there if it's okay. I'm curious to know. So you talk about some vulnerable things related to family experiences that you've had, and I have similar things that have happened that I want. I feel like I have helpful stories that I can share, but it's so hard to know what to share online and what to keep private. So I'm just curious, how do you navigate that in terms of like how do you draw personal boundaries regarding what you talk about and how you use it to teach in the context of your channel?
That's such a great question. I say this all the time. I started making content at 50. I hated Facebook from day one because it was when I got divorced, it kind of became popular. And I just inherently noticed that I felt bad about myself. I was like, well, you guys are all in Hawaii and I'm, dragging 4 kids through the mall, ages 1 to 9 by myself. And so I didn't use it. And then same thing with Instagram. Nope, didn't use it. I love TikTok. When it first came out, I felt like that was a place, I think, to be authentic. It was easy.
Mhm.
And I was like, I didn't create for like a year. And I think that coincided not too long after I started YouTube. And so I'm saying this because it was like my whole life I was afraid to really say what was going on. And then I started finding that the more, there are places to share here, people actually feel seen. I felt like no one had a mom like I did. It was
Mhm.
crazy. And then I realized in my caseload and, people posting that, oh my God, this is actually a common experience. And so in that regard, I have, I'm working on a book and I have a lot of personal stories. I'm
Yay.
deciding, what to put in there and what to leave out. It might be a whole book on those stories. But I just feel like, I don't know, something is pulling me more and more, and people seem to respond to that. So I don't share anything usually. This is actually what I should say, and when I'm right in the middle of it. Like I might say, my kid
Mhm.
fell through the window or whatever I told you, my kid fell off of the roof. Or I might say something like, my kid's in the hospital. I'm not going to talk about all that's triggering in me for the most part,
Mhm.
maybe until later.
Yeah.
So that's kind of how I
That's a really good point because I had a lot of people ask me about my divorce as well. And it's like, it feels way too fresh to talk about. I mean, it's been 2 years since it was finalized now. But yeah, I think that's a good framework to work with is like wait until it's not super fresh so you're not speaking from like all this hurt and pain because that can not that that's not okay but maybe not on a public platform when you're trying to bring clarity and insight and also just inviting lots of criticism into your life.
Yes.
So yeah, thank you for your insight on that because I'm always unsure and like with children too. I never want to put anything out there. They'd be like, "Mom, like why did you, why is that online?" So it's constantly this line of, well, I want to help people with the past that I've lived and the stories that I have, but I'm never quite sure of how much to share. So I appreciate your insight on that. But in terms of our topics today, I'm looking back through my questions. Is there anything that we should be talking about that we haven't answered yet? Anything that could be helpful to the community in terms of the intersection of trauma and autism and narcissism?
What to think about that? I guess my one of my first thoughts is, this idea of self-diagnosis and trusting yourself. I think that people have been gaslighting, we've been gaslighting ourselves, most of us, our whole life. Like, what's wrong with me? What I feel isn't real. And so when they start to ask, is it trauma? Is it not? To sort of give themselves permission to explore what that is, but not be rigid about it because there can
Mhm.
be that literal thinking. So I think giving ourselves permission it can be both, right? To identify. I mean, I had one the other day, she just said, I was watching your videos and I'm 16. I just got a diagnosis the other day. It's like, I think what I'm doing is, and does anybody really care? But it's like, it does matter to talk about
Mhm.
your stories and who you are. And so I don't know. I think that's all important.
Yeah, I think that piece of trusting your intuition and then discovering what you even want and need is so important for autistic people, especially autistic people finding themselves, in narcissistic relationships. Because I think there's so many ways in which we have to downplay what we want and need, maybe without even realizing that we're doing it. So maybe this is silly. Maybe you have some other tips like that you could share. But one thing I tell people in my community is when you're trying to figure out what you want and need, it can be as simple as going to the grocery store, even though that can be overwhelming. Just and picking a new cereal that you've never tried before. Just picking something and then deciding, did I like that or did I not like that? And even something this simple can kind of help rebuild your trust and just giving yourself the opportunity to have an opinion sometimes can feel scary. Are there any other tips that you've seen or strategies that are successful for helping people get back in touch with who they are and what they actually want?
That's actually a really important point. I think that identity development is often, complicated to people that have difficult childhoods for whatever reason. So we've learned to, be this version, especially in autism. If you learn to mask a certain way, it's like, well, who am I really? And then who
Mhm.
can I unmask with? And is that can be risky and dangerous too,
Yeah.
right? And so I think that's important. And you know, at the end of the day, to be with a narcissist is sort of like, I think people get so hyper focused on identifying the narcissist. And that's why I think a lot of these channels of narcissism blow up. And I've had so many patients who will like watch Dr. Romney's videos, like the same video, like 10 times in a row.
Yeah.
Because they
Mhm.
just don't. And it's like, it blows my mind. That is the only topic I think that people will literally rewatch because been so deeply ingrained that it's not
Yes.
it's you know what I mean? I'm broken and did I really
Mhm.
did that really happen? I'm like, yes, it was narcissistic abuse. And they're like, are you sure? Yeah. I mean, it's crazy. So
Mhm.
I think at some point you have to flip that back on yourself. So you can get so
Mhm.
good at detecting, are they the narcissist and what to do, that you're losing sight of kind of what we're saying is identity. How does it make you feel? What are your options? What do you need? And
Mhm.
that's hard to do when you haven't, you were actively encouraged not to do that, or for
Mhm.
survival reasons you didn't do that. So I do think it's important to stay on ourselves because we can get so focused
Yeah.
on the strategies, which we need, but not completely.
Right. Well, that's really resonating with me because that was pretty much my journey where it was like I was like with my psychologist, I needed them so badly to just over and over and over and over and over again help me just believe my reality over and over and over and over again. And that was a super important part, just like you're saying, watching Dr. Ramani's videos over again, because you're breaking this understanding that you had of again that alternate reality that you're trying to make fit your life. It's like coming out of a dream, and you have to have somebody to help bring you back to like a stable ground. But then, like you're saying, the switch back to, okay, well, now I'm on stabler ground. Okay, maybe it's not as stable as I want it to be. But in order for it to feel more stable, I actually have to start trusting my experience and trusting, oh, that interaction felt off to me. I don't need to schedule a therapy appointment. I can just trust, I can trust that that interaction felt off and I don't have to justify it to anyone. I can just trust that that didn't feel right and just use that knowledge to shape my future conversations. So that's, yeah, that's been very true for my experience as well. I could talk to you forever, but I feel like this is really great feedback for the community. I feel like it's helpful in terms of us just understanding patterns, like you said, patterns, getting back in touch with our intuition. And I will make sure to post all of your resources in the description. Please go check Dr. Kim out. She's on TikTok, Instagram, YouTube. I'll put her
Substack,
website. What else did you say?
Substack. I just started posting on Substack.
Okay, I'll put your link to that in the description too. But I'm so inspired by you right now because I'm like, you're a mom, you're a single mom, you're doing it, and you're, making a name for yourself, kicking butt, and you're super smart and fun to talk to and enlightening. So thank you so much for sharing your time with me. And I'm looking forward to staying connected and, whatever opportunities might present themselves in the future. It's really nice to meet you. And thank you for sharing your expertise with us today.
Thank you. I was so thrilled when you reached out, and I would love to have you on I keep saying it, my goal is to start doing more interviews, and I would love for you to come on my channel.
I would absolutely love that.
We can brainstorm on topics, but I think just being a mom and discovering this link to me, I think so many people we're still in the like, oh my gosh, I'm autistic. Like there's so much there to
Yes,
talk about and the varied experiences. And so I would love for you to do that. And I appreciate you having me on so much. It was
absolutely.
great. It was wonderful. Thank you so much.